Gamble or not, the lines keep forming, the numbers smaller than expected, many of the recipients nervous and concerned.
I was a little nervous before I went in for the flu shot, but we feel fine now that it's over, and we hope that everything will be all right. And the reason that we were upset was about all the notoriety that was received from other parts, particularly New Jersey, where they had so many deaths. But I don't believe that the United States Health Department would allow them to give us the shots if they weren't right to be given.
I'm 85 years and my wife's 76, so we figured old folks ought to take it.
Yeah. But you had read the reports about some after effects from some people?
Yes.
They didn't bother you at all?
No, it didn't bother me. Just a drop in the bucket for few that was affected by it.
Didn't bother me at all. If I had to go, I go anyhow. But I had this flu in 1918, so I know what it is.
It didn't worry us.
So you think the money the government's spending on the program is well spent?
Oh, I think it's wonderful because I remember the flu of 1918-19. I was a small child, but I remember it. We buried 3 in 1 week from one family. So I'll take it.
But there's even more concern about another factor. Some medical opinion in America holds that because the government is immunizing against swine flu, which as of now is not present, it will mean most Americans won't be able to obtain a shot against another virulent flu strain, Victoria type A, which is already confirmed to be here.
There are two main problems. One, on its own right, the idea of mass immunizing the entire country against a disease which doesn't exist is a gamble at best, and at worst it's a waste of probably $200 million of money if you add up the cost of administering the program. There hasn't been a single case of swine flu anywhere in the world in 8 months since the small outbreak at Fort Dix, and we are the only country in the world that is planning to mass immunize the public against swine flu. So that's a major objection against the program. But a second objection, which is I think even more serious, is that because of all of the foul-ups and bungling of the swine flu program, the American public is standing a reasonable chance of being injured because of their inability to get vaccinated against a flu, A Victoria, which, unlike swine flu, is going to occur.
And so, Americans are staying away in droves.
You're planning on taking the swine flu shot this year?
No, I'm not.
Why not?
Well, I believe in going along with nature. Nature knows better than anything else.
I'm hesitating about taking the shot.
You're hesitating. Why?
Yes, I really don't know. I just feel a little leery about it.
No,
Why not?
because they're scared.
I think so, but I haven't made plans yet.
I'm from Seattle. I don't know whether I will or not.
How about you?
I'm going to contact my doctor, my physician, and ask first.
Have you asked your doctor whether he thinks you should take it?
I haven't been a doctor in 20 years, so I'll see what my wife says about it. See, we both was way up there in age, and so I'm kind of scared of those things.
Not at my age. Can't afford it.
What do you mean you can't afford it?
If I were a younger man, I would take it. But I believe the old people should reconsider.